Our State of the U.S. segment tonight. On Tuesday evening, Senators Ted Cruz and Bernie Sanders squared off in a debate about Obamacare. The contrast in opinions could not have been more clear, but it appears there may also be some disagreements within the Republican Party on how to proceed when it comes to repealing Obamacare. Earlier that same day, House Speaker Paul Ryan said that Congress would in fact pass legislation to repeal Obamacare this year, despite President Trump saying we may have to wait until 2018 for the law to be repealed. Take a look.
We are pressing ahead step by step. Now, I know that there are strong views about this. There should be strong views about this. Healthcare is very personal. That is why we are committed to getting this right. That is why we are committed to rescuing people from this collapsing law and replace it with a much better system that is a patient-centered healthcare system where we as patients and our doctors are the nucleus, the decision makers of our healthcare system, not some distant bureaucracy. That is why we're going to do this step by step and do this right and replace it with something that is far better for families, far better for patients. We are going to be done legislating with respect to health care and Obamacare this year. The question is, how long does it take to implement the full replacement of Obamacare?
Joining me now, CEO of the Association of Mature American Citizens, Dan Weber. Dan, thanks for being here.
Pleasure.
All right, Dan, we just heard Speaker Ryan said that legislatively, the House of Representatives, the Senate will repeal Obamacare this year. They will be complete legislatively by the end of this year. President Trump says it could possibly be until 2018. Dan, President Trump promised he'd address it right away when he was campaigning. Why would he wait?
Yeah, the voters would be very disappointed if Obamacare wasn't not only repealed but replaced this year. The reconciliation bill will take care of the repealing, and that will only need a 51-vote majority.
Right. So basically you're saying you agree with Speaker of the House Paul Ryan. You see it being completely repealed by the end of the year.
That's correct. Not only repealed, but it's actually easier to replace than people are believing. If you take a simple HSA, a health savings account, and greatly expand it, change the law, remove the cap that's on there now, and also allow for insurance premiums to be paid right out of the HSA, that's the easy, simple way to do it.
Right. Well, maybe you should be talking to Congress then, because there seems to be some infighting among Republicans on how exactly to get this done and when. There was something interesting, Dan, I wanted to talk to you about. On Tuesday night, Senator Ted Cruz and Senator Bernie Sanders faced off in an Obamacare forum. They talked about solutions. Both of them actually admitted that Obamacare is flawed, that something needs to be done to fix it. But needless to say, very, very different solutions that they presented. Let me ask you about this. Senator Sanders, his main argument was that the United States is the only high-income nation that doesn't guarantee health care, that doesn't have universal health care. My question to you is, a lot of people actually ask that question, why wouldn't it work?
Well, it wouldn't work with the way Bernie wants to do it because he wants to tax us to death. The way to do it is to actually cut your medical costs. That was a great failure of Obamacare. It was supposed to reduce medical expenditures across the board, and in fact, as people who pay the premiums know, they've gone up almost double.
Right. I mean, you just have to look at the averages along the states. It's absolutely dreadful. I mean, I think that's one of the reasons President Trump was elected, because people can't afford their health care. But Senator Sanders also said if we repeal Obamacare instead of just trying to fix the flaws in it, that millions and millions of Americans would be left uninsured. And that, I think, is a very scary prospect. Like Speaker Ryan said, health care is very personal to people. It's why people feel so strongly about it. Is that accurate, that millions of people would be left without insurance if Obamacare is repealed?
No, he's absolutely dead wrong. Unlike when Obamacare started, there were supposed to be navigators to help people navigate the maze, only they were very ineffective. The website was horrible. The HSAs would be handled by individual agents. So you'll have a personal agent will approach a small business, an individual, or a group and say, let me counsel each one of your employees. This is how the HSA would work. We simply roll over your health insurance into the HSA. And by the way, we provide a local doctor in the HSA where you have no deductible, no copay. So if you want to see your doctor, just join the HSA. And that's what Paul Ryan was talking about. Not just replacing it, but improving it.
Right, because I think it does need to be improved. Something that Senator Cruz said that I thought was shocking. I'm not sure very many people know this statistic, but in 70% of counties across our country, people, if they're using the Obamacare exchange to find their plan, they only have a choice between one or maybe two plans. 70%, Dan, in 70% of counties, people don't really have a choice. It's monopolized.
That's right. Not only that, the disaster could be if those few companies who are staying in the insurance exchange market decide to get out. So the way the HSA would work is they would take people in the exchanges, the people who get government support, the government support would simply go to their HSA account. And when people save for their own health care, they have a say and they work with their own doctor. It's amazing how the rates will go down.
Right. It seems like a relatively simple solution to a very complicated problem here. Dan, we're almost out of time, but politically, from a political perspective, I should say, let me ask you this. There are a lot of Democrats who voted for Obamacare, but who are in states that voted for Donald Trump this past election. Do you expect any cooperation from those red state Democrats when it comes to repealing and replacing Obamacare?
Well, unfortunately, the Democrats so far haven't cooperated with very much. So there has to be, I think when the people start to tell their Democratic elected officials, come on, let's help work together, let's get this thing solved. And I think they'll get tired of complaining. And once Donald Trump's programs start to work, I think it'll be a healing time. And we got good people like Pence and Ryan, and together we should solve it. It's not that hard.
Right, I hope not. The Congress certainly makes it seem like it is hard. And I think the challenge is that it takes such a long time for these programs, new programs, to roll out. Just like we saw it took so long for Obamacare to get fully implemented, it'll take just as long for a new program to get implemented too. Dan, thanks so much for coming on the show. It was great to talk to you, sir.